Hi, we're Group 20, and for our profession, we chose nurse practitioner. My name is Danny.
Sephora. And I'm Priscilla.
So, according to the American Association of nurse practitioners are licensed, autonomous clinicians focus on managing people's health conditions and preventing disease. A fun fact is nurse practitioners comprise the largest group of non-physician primary care providers in the U.S., with more than 50,000 providing primary care services. So for areas of improvement, we chose hiring, job satisfactions, and poor leadership. For hiring, a few problems were to reduce physician workload and fill gaps in the physician shortage. Many healthcare organizations are hiring nurse practitioners, but they tend to eventually burn out. Nurse practitioners can generate similar revenues at considerably less compensation than a physician. So if you want to zoom into this picture right here, it shows that nurse practitioners almost make half as much as a physician. Okay, and a few solutions are for employee recruitment to use realistic job previews, just so that the person wanting the job can know what the job entails. So they should draft a realistic job preview to hopefully prevent work burnout. Companies should also screen to find the most qualified applicants who are likely to remain in the company. Also, companies should also recruit directly from nurse training programs. Those usually have the best outcomes. Some physicians prefer to also hire new grads and teach them their personal practice style. When hiring, their level of autonomy should help you determine whether a new clinician would alleviate some of the physician's workload. So this could help in like a private practice if a physician is just looking to lessen their workload. And for ways to improve the interview process, companies could reduce bias. They could reduce discrimination in employment. For the most common discrimination in employment, it was being passed up for hiring or promotion, and this was in minority groups. Fun fact is, in 2011, although women outnumber men 10-1, male nurses get paid nearly $10,000 more a year. So with these solutions in mind, this will improve employee motivation and employee satisfaction.
Section is job satisfaction, and the problems that are currently with nurse practitioners in this section is insignificant recognition, assertive influence, poor relations, and administrative support. So a study done by the Journal of Clinical Nurses in 2013 was conducted to see the job satisfaction of nurse practitioners. And in this study, they were looking at the job satisfaction based off of a scale that they did surveying and things of the same sort. And they found that it was, for most nurses that they looked at, it was an either or. It was minimal satisfaction. So that means that it wasn't necessarily dissatisfaction and it wasn't satisfaction. So they were in the middle. And fast forward to 2017, according to the US News and World Report, this is how nurse practitioners have satisfaction rates on the following terms. So their upward mobility is average, their stress level is above average, and their flexibility is below average. So that basically, going into the stress level and the flexibility, with their stress above average, that can make the job hard to concentrate and to be able to put their all into the things that they are doing. And with flexibility being below average, that means they have timelines and they need to stick towards those. So knowing this and going back over the problems, insignificant recognition, it's among their peers, not the people who are around them, like their patients and other facility members. It's the people they actually work with on a day-to-day basis. They don't feel that they are recognized as professionals. And because of this, poor relationships develop. And when it comes to administrative support, the people that they have to correlate the most with are physicians, but the people that are in charge of what they do and the level of reporting it and seeing how good they are actually doing, don't actually know exactly the steps that they are taking, so they don't feel like that is good support for them. For solutions, base it off of intrinsic motivation, and by doing that, if they feel that they can identify their training and developmental needs through surveys and be able to do training sessions on the things that they feel that they need improvement on, and then after using that and understanding the things that they are doing, they could use organizational developmental programs such as T groups and team building. With the team groups, they can find out what motivates them specifically and why they are actually doing the job they are doing. And with the team building, they can work with the other people that they have to work with on a day-to-day basis, but in a different setting, so they can have a better relationship building with them.
So for our final area of improvement, it would be leadership. Some problems that arise in leadership would be efficiency and reliability, trust, and managing change. Healthcare organizations often have to implement new company designs in order to keep up with the ever-changing medical practices and technologies. These changes and methods often call for reductions such as downsizing, outsourcing, and cost-cutting. When organizations such as healthcare organizations do so, it leads to problems of miscommunication and lack of reliable care for patients. This miscommunication leads and causes lack of trust, and this often arises because of the poor management of change. So some solutions would be job enhancements such as reward structures, organization structure, and job structures, creating and sustaining trust, and actively managing the process of change. This can all be done by ongoing communication, by making sure that that the level of communication is always open between management and workers. Better training, mechanisms of feedback, being able to openly express dislikes and likes within the workplace. Measurement and redesign, so that would be something like measuring how satisfied you are with your job, and also measuring how satisfied you are being able to talk with your administration in order to keep an open work field. And another useful solution to have an effective leadership foundation would be to use different forms of pay, such as merit-based pay versus skill-based pay. So we believe that a merit-based pay for physicians should still be intact. However, having a merit or a skill-based pay for nurse practitioners, because this allows them to be based on their worth ethic rather than their merit, because oftentimes nurse practitioners feel unappreciated because they're doing such the majority of the grueling work that physicians don't have to do. And this allows nurse practitioners to be openly communicating with their leaders.
How the field of psychology can improve the
Field of nurse practitioning. Thanks for watching.